Hi everyone, welcome to another video. In this video, I've got a question about conditions that show symptoms similar to TB. I mean, I'm not really sure if the symptoms are indeed similar to TB, but I'll read you the question. So, what other diseases could show the same symptoms as TB? My husband has not been in contact with TB, but has been a welder for about 50 years. Now, this is a fantastic question because I think there's this big issue about occupational lung disease that's not really discussed as much as it should. Because it's actually quite common to find people who have had different occupational exposures to all kinds of things. So you can imagine people work in so many diverse circumstances. It's amazing to me sometimes the stories I hear from my patients of environments they work in, and sometimes it's just like there are some people work in crazy places sometimes with minimal respiratory protection. So you can imagine some people are protecting their eyes against all kinds of shards that come through sometimes, or they use gloves, but many people don't actually use masks or something to protect themselves when they're inhaling all kinds of dusts. And this is interesting because welding does release, it's a great question. The reason why I picked it is because welding can actually release some vapors that may contain hard metals, hard metals. And basically inhaling those over a long period of time can actually cause lung disease. It can cause COPD or even other more complex and rare conditions that are associated with inhaling all kinds of fumes from the welding process, especially if you're sitting just hunched over the piece of metal that you're welding. So there have been cases of these sort of conditions. But just to go a little bit on a tangent, I can talk about other conditions as well. First of all, let me just explain same symptoms as TB. So let's just clarify that. So tuberculosis can have various symptoms depending on the organ affected. Most commonly, it affects the lungs. Now, when it affects the lungs, you'll usually get cough, sputum. People usually have progressive weight loss, even though they eat well, is because it used to be called consumption, tuberculosis, because your body is trying to fight off this infection and it's using a lot of energy to do that. So you're starting to lose weight. Sometimes people may have sweats, especially at night, these sort of cold sweats, and tiredness, fatigue. These are very common symptoms for tuberculosis. There can be other things as well. Like I said, depending on which organ is affected. So if it affects the pleura, if there's a bit of an effusion on one side of the chest, there may be pain. Or when you're coughing up phlegm, there may be a little bit of blood if there's advanced disease in the lungs. There may be a lot of symptoms for tuberculosis. But as you can see, these symptoms can sometimes be caused by an infection. They can be caused by other forms of chronic lung disease. So I was going on this little tangent about other occupational lung disorders. And it's important to just think about the environment where you work. Is there anything there that can be causing damage to the lungs? And I actually saw this gentleman. I was in my hometown a few months ago, and I was going past this construction site. And there was this gentleman who was working on the construction site, and he was wearing just these headphones to protect his ears against the noise, but he was hunched over this bench and he was cutting stone with this machine, and he was cutting this piece of stone with this mechanical thing. There was so much dust all over his face, his eyes, his clothes, and he was inhaling all of that dust. And I was like, I actually, as a lung doctor, I wanted to go and tell him to please put on some sort of a FFP2 mask, something that would protect his airways. Even though he was doing it outside, which is still better than doing it inside a closed space, but it was still shocking for me when I saw that, because I work in interstitial lung disease. This is sort of my subspecialty in pulmonology. And we see a lot of patients, really, who have inhaled a lot of dust, a lot of things, and they develop lung fibrosis, lung scarring because of that. It can happen in coal miners. It can happen in people who cut artificial stone. So especially the new types of stone, they contain a lot of silica. And there's been an uptick in silicosis cases recently in young individuals who are cutting stone. This sort of decorative stone that you pave your garden with, you put on the side of your house, things like that. So it's actually full of silica. And silica dust can cause silicosis, which can cause fibrosis. It can sometimes be associated with tuberculosis that's on top of the silicosis. So there's lots of issues to think about. So and so many people work in construction all over the world. So if you are working in construction, please try to wear some respiratory protection. Think about what will happen in 20, 30 years from now. So especially if you're 30 years old, you're a fit guy, you're working on a construction site, you're cutting the stone up, you feel great, you go with your mates, you do something, but slowly, all that dust is accumulating in the lungs. So I really urge you from the bottom of my heart, try to use adequate respiratory protection. An FFP2 mask is usually enough. So these are the sort of masks that are a little bit thicker, not the surgical mask. They don't do anything, the surgical masks, because you'll have all kinds of gaps around the mask through which the dust can come in. But if you wear an FFP2 mask that sort of seals around the airways and you sort of close it up well, it should protect you to some extent. I understand that if you're working in a hot environment, it may be difficult to do that, but at least try to ventilate the space well. Ask to potentially try to do some of the work outside. Talk to your employer and demand protection for your airways, because you won't be able to do much if you are very ill when you turn 50, 60. You have severe COPD, you're struggling to catch your breath. What do you do then? And for most cases of these sort of occupational lung disease, unfortunately, there's no reimbursement. So unless it's something related to asbestos work, and there's less and less asbestos in the world, there are very few claims that you can make to your employer, because they will just say that, well, it was your responsibility. There are no regulations to protect you very well in these cases. So you probably need to take this onto yourself to protect yourself. So I'm sorry if this sounds a little bit grim, but there are a lot of problems that can occur from occupational lung disease, and that's what I wanted to highlight in this video. Hopefully it was helpful, and I'll see you in future videos. All the best to you. Take care of the lungs, please.